would say most of the patients with COPD tend to be at the older end of the spectrum. However, more recently we are coming across patients who are 40 plus, but they do tend to have maybe been in contact with other things besides just smoking. So they might be marijuana users, or they might have had cocaine use, and unfortunately that accelerates the destruction of the lung tissue, so they present a bit younger, unfortunately.
COPD is a chronic disease, and I think chronic diseases are very hard for patients to accept, and also for clinicians to manage, really, because it's not got a disease trajectory that's straightforward. So patients with COPD can have good days, bad days. They can have spells where they're really unwell. They can have spells where they're really well. With COPD, it's kind of a bumpy road. They don't know where they're going to be on that. And they have an infection. They feel very unwell. They think that's going to be the end, and then they get over that and they feel that it's everything's going to be all right again. So it's not an easy path for them.
The ones who tend to get most out of what we're giving to them are the kind of characters who will take on board the advice, who want to go ahead and do pulmonary rehabilitation. Pulmonary rehabilitation is an absolutely fantastic thing for people who've got lung disease. They'll get the exercises the lungs, it teaches them about coping. They have a coffee, they'll have a biscuit, they chat to other people who are they're going through the same thing. They learn coping mechanisms, and from the beginning of that course to at the end, they can be a different person, and they absolutely love it. It's just motivating people to get in, and then they're a bit scared, but when they do it, they love it, and they say it's the best thing I've ever done, and I'm so glad you said it.
Our pulmonary rehabilitation classes are extremely successful. However, there's a huge waiting list for them, and we don't have the funds, if you like, it's a rolling programme for the patients, and we would love to have 2 sets of classes going at the same time. It gives them confidence as well, and it reconditions the chest. So, and we also give them a little leaflet to take home to promote these exercises at home as well, because without realising it, they do less and less. They think, oh, I'll not go up the stairs and take the washing up, I'll go up later. And so they do less and less, and they become like a prisoner, if you like, in their own walls. Just remember, it's never too late to stop smoking. You can, for yourself or for family members, you can always promote it, and always come and seek advice from your GP or your practice nurse is a good place to start. Anybody will be always willing to help you, because it's a threatening disease, a life-limiting disease, and has lots of implications. So my advice, never to stop. It's late to stop.